Estás escuchando A Tu Salud con William Rodríguez, un show para motivarte a ser la mejor versión de ti. Te invito a escuchar la información más actualizada de la boca de expertos en diferentes ramas de la salud y el bienestar. Gracias por acompañarnos. Hola familia, quiero contarles que el objetivo de este podcast es únicamente informativo y educacional. La opinión de los expertos invitados no necesariamente refleja mi opinión, ni la de mis colaboradores. La información expresada aquí no reemplaza el consejo médico. Si tienes dudas acerca de tu salud, consulta con un profesional. Welcome everybody to the podcast A Tu Salud, which means in English, to your health. We are in a very special place and with a very special person. This is Dr. Viet, and today I realize I've been butchering his last name. My wife corrected me. But anyway, I've known him for a long time, and he's been very important in my health and wellness throughout many years. And he's gonna take us today into the world of what a chiropractor does and why it is important to be taken care of by a chiropractor. Now, I have to say, what he does is beyond what a regular chiropractor does, and he's gonna take us into his world, and he's gonna explain a lot of very cool stuff. Welcome to the show.
Thank you.
And why don't you give us a brief introduction? What have you done, who you are, how you got here, and more importantly, who that guy is?
Sure. So first of all, thank you so much. Seeing you again.
Yeah, this is such a treat.
Yeah, congratulations on your new venture. I just love it because for as long as I've known you as well, great man, great educator. You've always had that curiosity, and we think alike. And I think that's part of the reason why we keep on pushing the limits of what makes us happy. So I am a chiropractor. That's what my degree allows me to be. But it doesn't really confine me to the kind of to become the clinician that I am today. Mm-hmm. Within the chiropractic profession, a lot of times people assume that it's things relatable to, let's say, the spinal column getting adjusted. In fact, everybody in the world can understand what that means. You can see all over social media, AI-generated chiropractic videos where people are getting thrown off the tables and stuff. And I find that very funny, but frankly speaking, I think it's actually doing chiropractic an injustice.
For sure.
Getting the word out there, but not necessarily achieving the real goals of what that's supposed to mean. I started off as a chiropractor, and I still do practice as such, but I think my mind allows me to think beyond that, because before being a chiropractor, you got to think about the license itself. The license means Doctor of Chiropractic. Just like a medical doctor or a doctor of osteopathy, a doctor of chiropractic is in fact a doctor first. Uh-huh. And the Greek translation for doctor is ironically a teacher. So I want to get back to teaching. And when you're able to use that doctor of chiropractic title, all of my patients get educated in why they're in my office, and then be able to have a strategy to help them explore health strategies to get better, no matter where they're at, from a young child to a person in their 80s.
Yeah, I am very grateful for you spending time with us and, again, educating our audience. The purpose of this show is, first, create community and also create culture. It is great. And, again, I was telling you about somebody I interviewed recently. Having someone who is first an educator and who has the passion, the desire to educate people and teach on whatever they're experts, right? Yeah. It's a gift. Yeah. And again, this is a gift from you to me and to everybody who's watching this.
Sure.
So thank you again. And how would you describe what you do as a chiropractor and why it is important? Maybe let's start with why your profession is needed today.
Yeah.
Because I think that as a society, as a collective, we are incredibly sick, chronically sick, sicker than we've ever been. Yeah. And why is this important?
Yeah. By the way, to answer your question earlier, this is Kaito. He's
He's the star.
he's the star of my show. You're the star, Kaito. Anyways, you want to go down? You want to go down or you want to sit? Okay, all right. Anyhow, why is chiropractic needed in our profession? So the premise behind that is really simple. Structure determines function. That is the foundation, in my opinion, of what chiropractic ought to be. When you have a structurally sound foundation, it's going to function the way that it's designed. So I'll give you an example. You've got a table that has 4 legs on it. And if those 4 legs are balanced, then you can put whatever you want on it for what it's designed to hold, and it's going to hold steady. You can try to move it and pivot it. It'll just slide if you move it hard enough, but it won't wobble. So the idea here is that if you have something that's structurally sound for its design, then it's going to support the very frame that it's supposed to. Now, imagine if one of those legs was shortened, just even by a millimeter or 2. If you were to put that onto the table, what happens to it when you actually try to move it? It actually becomes unstable.
Unstable.
Right. So our human frame's the same way. So when I think about what actually supports chiropractic, you got to think about the alignment of the head and neck, of the mid-back, of the lumbar spine, the lower back, and the pelvis as it connects to our feet. So chiropractic got they got it right in the sense that they want to focus on the neurological components of the human body because the brain, through the central nervous system, controls all of these wonderful biofeedback systems that help us maintain balance. So for me, knowing that in chiropractic school and learning that in chiropractic school and having a foundation has allowed me to really think about what we can do on a diagnosis level to treat patients with certain conditions, but also take a step back and look at how we can improve the structural integrity of a person, regardless of what their diagnosis is. So it's very complex. When you think about the word itself and the profession itself, to me, it wasn't ever enough, to be frank with you. I mean, the structural things are one component of health. We have to think about the physiology, what makes us, tick, what makes us move, what allows us to breathe. All those things are vitally important. And then we also have to think about our mind and the very things that we're able to control. So as I've evolved through my career, I think I've been in practice for almost 25 years now, getting a little old.
It's crazy. You look 25 years old.
That's funny. Thank you for that. But yeah, it is neat in the sense that when you're able to look at the structure as it affects the function, when you're able to pay attention to the physiology of what your body is going through homeostatic strategies, which is a strategy to maintain balance. And then ultimately to improve our mental wellness and to be able to allow us to be able to pursue our happiness. Well, those things make up who we are. So to me, it's very simple. I call it our 3P strategy: physical, physiological, psychological.
That is very it's very interesting that you mentioned it is just one component of a whole, right?
Yeah.
And again, we were just talking about things that we see in the internet and how it is the view of what you do is very simplistic, right? But in fact, it is very complex and it involves a lot of things. I wanted to ask you, what things contribute to the lack of that balance in our day-to-day life? Because we go through life and we think we're doing fine, right? But I know that unconsciously we do stuff that goes against that balance.
Yeah.
Why don't you give us some light on what are we doing that is kind of like taking us out of that balance?
So when I think about health for an individual, I see all sorts of people, right? From young kids to older kids. So you have to look at the individual for where they're at. So going back to what is it that we're doing that allows us to be vitalistic? Well, that's a tough question to answer. But, the reality is that it's not as hard when you actually have to look at your frame. So let's just give you an example. You're a 5'10", 5'11" gentleman. You work out regularly, right? You feel like you're able to thrive and excel in what you do. You're able to have good energy when you wake. So, what is it about you that wants you to, let's say, go further or optimize? Or conversely, what is it about you that makes you wake up in the morning and say, you know what, I don't feel so good today? Or I don't have the energy to be able to push through. Or I have some pain that's just kind of, weirdly present, but I don't know why. Well, these are the clues that our mind is telling us that there's something off. Well, being off isn't common, frankly. Yeah. So it's really important to recognize where you're at with your health and be able to identify where you exist. So, as a, let's say, 50 something years old, well, health is very critical for us now because we know that imminently we have 20, 30, 40, 50 good years, if we're lucky, left.
Yeah.
And so, we want to be able to enjoy that and preserve that as long as we can. So I just think that we have to learn where our body exists, understand what motivates us to make decisions that are good for us, and then ultimately parlay those strategies into longevity.
Walking through your office, again, I have to say you've gone beyond what a regular practice does. And there are so many components that come together to play a significant role in anybody's health and wellness. I would like to go maybe component by component and maybe explain a little bit what every single thing does, and at the end maybe bring it all together and see how all these components play such a big role in a whole picture.
I always start off with the foundational things, which is the physical. When we think about our physical anatomy, we have to think about our capacity. So the way we breathe, the way we move, the way that we are born and grew into our body shape, minus injuries or with injuries, those type of things happen to us throughout. So if you're thinking about how to improve our health and longevity, you've got to look at what you're capable of doing. And most of us are walking around and we're probably not even aware that we're not efficient in how we're
absolutely.
breathing.
Yeah.
And how we're breathing.
Yeah. We're not even conscious of it.
That's right. Because when you're sitting here, you and I talking, right, and conversing and having a lunch afterwards or whatever it may be, well, guess what? We're living. So how are you going to look at that and say, that it's a problem when we're able to do these things without feeling like we're held back? The reality is that people learn how to adapt. So let's just give you an example. If you woke up and you're tired and you have bags underneath your eyes, well, who's to say that you didn't get a good night's sleep? And what were the limiting factors with that, right? The limiting factors is that you may have sleep apnea, or you may have stayed up too late, or whatever it may be. But let's say you didn't abuse yourself and you didn't do anything but try to sleep, but you couldn't. That tells me that your physical anatomy couldn't get enough oxygen into its body at night to allow you to get to metabolic states of recovery and to allow you to repair in a way that will be sustainable for the next day. Now, I focus on the airway a lot because the functions of our lungs, the functions of our heart, all those things are things that will help us determine how we can have longevity and be active along the way. I find that to be the biggest issue in my office. Frankly, as a chiropractor, people come in and see me for, back pain and neck pain and everything else kind of pain. But when you're able to take a look at them structurally and say, your pain symptoms are not really coming from where it's hurting, but it's a dysfunction, which is an accumulation of symptoms.
That's often the case, right?
Then it blows their mind because they're just confused.
Yeah.
It hurts here, but how can it be from somewhere else? And so what we do in our office is to be able to simplify that strategy, and then we're able to use those tools and measure and identify where the solutions can be.
You really have I don't know if the word biohacking means anything to you,
Of course.
but I think you're the ultimate biohacker, just walking around your office and seeing everything you can offer to your patients, right? When you talk about oxygen, you have something here that you can provide to your patients that is incredible. It's an incredible tool that can expedite recovery, and it has so many benefits.
That's right.
Why don't you tell us a little bit about the benefits of the hyperbaric?
Yeah. So the hyperbaric chamber is very simple. The concept is really simple. It's literally a chamber that pushes oxygen, pure oxygen, into an enclosed space with increased pressure. It's very similar to if you were to take off on a plane and then the air has to pressurize. So your ears would pop and you have to ultimately equalize. So the reason why that's relevant for recovery is because when you're in that chamber at a mild state, 1.5 ATA, what it does is that it allows you to oxygenate. It allows your oxygen to get pressed into the capillaries of your lungs so that your body can manufacture all the necessary things necessary to be able to heal. Again, it goes back to oxygen.
Yeah.
Oxygen is the key to life. Now, we have the hyperbaric here as a strategy to help people recover and do all sorts of wonderful things. But frankly speaking, the number one chamber that I like to be able to focus on for people is their own frame. Because we do have that chamber, which is the capacity of our lungs and the capacity of our heart. And if that's not working optimally, then guess what? We're limited. So again, going back to what I was saying, understanding a person's anatomy and trying to change that metric so that they can have, let's say, an engine that's a V4 and that should have been a V6. Well, we're somehow able to take that V4 and make it that V6. Now you've got
That's a great analogy.
An engine that's more powerful, that's more capable of doing things.
Yeah.
Now, the hyperbaric is amazing because when people are lacking that ability, then it provides a solution. That's just like any commodity in biohacking.
Yeah.
If you really think about it, from red light to PMF to whatever it is that's out there right now, everyone is looking for strategies to be able to do things to force their body to repair and feel better. Well, why is it all of a sudden we have this massive push for this? Well, it's great that the information is getting out there, but the strategies are lacking because they're going around and picking each commodity. Oh, let's do red light because we hear it's so amazing. Or let's do hydrogen because we think it's so great. Or let's do hyperbaric because it's just so wonderful, right? Or let's eat this food because it's going to make us better or have more energy. Whatever it may be. Well, they're doing it based on the information that they are taking in, but nobody's actually taking a step back and looking at them and saying, does your body support this? Is your physical capacity able to take in all of this energy and be able to actually procure a strategy to build on top? Is your foundation relevant enough? Or let's say, for instance, if you're taking tons of supplements that are good for you, who's to say that your body can't detox from it? Nobody ever tells you what to stop or when to stop,
Absolutely. Or even absorb them.
Or exactly. So health to me isn't about just going in and picking and choosing what's a good strategy. We have to go back to a very simple strategy, which is look at our physical capacity, think about our physiological health, and then be able to tie that in with the decisions that we make psychologically throughout our lifetime. So when we're young, we actually have the capacity to really endure all of this because we haven't been toxic enough. Or we haven't built those resistance type of things based on, just being older, let's say.
Catches up though.
I'm sorry?
It catches up.
100%.
It catches up with us.
Because our body absorbs all these things.
For sure.
And what to do with it and how efficient we are will determine what our age is. Nobody thinks about that, right? We just think it's a function of old age. But the reality is that if you're able to procure a strategy to build your frame, to allow it to metabolically be awesome, meaning that it's not just, going through a motion of keeping you alive, but it's actually repairing you efficiently, it's to build you and detox efficiently, then you're going to slow down that process of aging. And in fact, that's what biohackers do. They want to slow that process down. I've met so many people within this last year that are influential, and it's fascinating. From Brian Johnson, who spends millions on his body to be able to look healthy.
I've seen some of the things he does. It's pretty crazy.
I was down at his conference. We were doing some work there, and didn't get a chance to meet him, but I was supposed to do an examination on him. but I was too busy consulting and working with other folks. But he's got 30 some, folks, doctors looking at every single metric possible to see how he can reverse his aging. And what's so neat is that I know what his strategy is, which is to measure everything. He's the most tested individual in the world.
Yeah. Yeah.
But you know what's so crazy? What's crazy is that I can look at him and I can say, you're never going to optimize because you're going to be limited based on your structural capacity. You'll never know how to tap into that because nobody is looking at his frame. He wants to be able to build his frame. He wants to be able to look good and, do blood doping.
Yeah.
Well, let's not call it doping, but blood changes.
Yeah.
But at the end of the day, when he's not doing these things, he's going to fall back into his anatomy in his form. How do you measure that? That's what we're doing.
Yeah. So basically, when you see it from that perspective, he has a ceiling and he won't be able to break through that ceiling because despite all the stuff he's doing, it's not optimized enough because he hasn't really realized that capacity has to expand in order to take advantage of everything that he's doing.
That's right.
Is that right?
Yeah, that's so right. And you couldn't have said any better. It is that ceiling. But you know what? How do you know what that ceiling is unless you actually test for it or have a baseline? So it's so important for us to be able to get baselines that actually allow us to be and know where we're at. So not everybody's going to be compared to, each other. Everybody's frame is different. Everybody's, timing and so on and so forth is different. So you got to look at it like that for every person that comes in, you've got to measure them for where they're at and then be able to identify and see how you can optimize their capacity first and then build on that along the way.
I was speaking with somebody recently about how healthcare is standardized, right? And we're missing the mark because everybody's different. Everybody's different, but the standard healthcare is the same for everybody. And it is lacking in so many areas. When you can stop and say, okay, you are different to this person in this and this and these aspects, then you can start targeting certain things differently from everybody else.
That's right.
They're gonna benefit you.
Yeah.
Personalized incredibly, right? But I think we're still far from that in terms of healthcare, wellness, and where we are as a collective in our society, right? And that's why it is very important that people like you come into play and start explaining and educating about why it is important to see beyond what we already know.
Yeah. Well, science and medicine is amazing. I've never been an antagonistic person when it comes to, medicine in general.
Oh, absolutely. Yeah.
So, the advancements in medicine is phenomenal. But what's interesting is that when we actually take some time to take a step back, we've got to think about, the health journey. So most of us only go see doctors when we are not feeling great, whether we're in pain or when we have some kind of dysfunction.
Unfortunately.
Then we're able to, react to that.
Yeah.
But the reality is that that's not the strategy for wellness. Wellness isn't about reacting to a symptom. Wellness is understanding how you can actually prevent things from actually getting worse. Yeah?
Yeah.
So as you were mentioning what you were mentioning, my brain was going and
Spinning.
I was thinking, yeah, it was spinning because I don't want to give my secret sauce away when it comes to understanding the strategy. Yeah.
Yeah.
To be able to simplify that model where you can actually treat the masses. Yes, the masses.
Yeah.
But do it in a very strategic way. And that means being able to create literally bridge that void that the best of medicine can have, and then the best of what alternative medicine can have, and then be able to have a place where they can go and measure their capacities based on the strategies that have created. I think that is critical for us to be able to actually have something meaningful that will last beyond me, you, and generations to come. Because that's what's missing.
Yeah.
That's what's missing.
Yeah.
But I also understand why it's evolved into this strategy.
Yeah.
Where we are, categorizing people. I'll give you an example. Blood pressure, 120/80 for everyone. Anything above, that's just, they have to kind of do that for various reasons, and we don't need to get into the details. But that's just an example. or high lows. By the time, anytime, let's just put it this way. Anytime your blood chemistry changes, you're in trouble. Right. So if your CRP levels are, elevated or whatever it may be, you've got something going on. But what happens if you go to see a doctor, let's say, and everything is normal, but you don't feel
But
well.
you don't feel well.
You're in pain.
Yeah.
What other tests do you have to do? So that's the society that we're living in. They have so many issues, but unfortunately, nobody can really tell them exactly how to and where to pinpoint it. And that's what I want to talk to you about today, because the very things that I know and what I'm seeing in my office, it's blowing my mind every single time I see a patient, and I'm able to recognize that pattern.
Yes.
And it should blow your mind too when you actually see it as well, because it actually crosses the boundaries of medicine, physical medicine, chiropractic, physical therapy, orthopedics, and dentistry. And I say dentistry because, frankly speaking, nobody mentions dentistry as if like our teeth are separate from us and we can take it out.
This is you have no idea how I feel. But maybe you know how I feel about this because I was a dentist in a past life, right?
Yes.
And it is so isolated from the rest of the systems, from everything, right?
Yes.
We see it as one component that has nothing to do with other components. And I interviewed recently a doctor who's a holistic doctor, integrative, and he talks about how he's had patients that come with something and that have gone to the specialists on whatever the subject is, right? And they can't figure it out, and then they come to him, who is an incredible guy, and he starts bringing everything together and finally finding out what the root of the issue is. And as you said, it has nothing to do with the symptom, right?
Yes.
It's somewhere else.
Yes.
But everything is interconnected.
Yes.
But unfortunately, we don't see it like that. Everything is so segmented.
Yeah, so let me tell you why that's the case. I understand from a professional level, when you are trained in school and you get this amazing education, whether it be, an MD, a chiropractor, or a dentist, each one of these professions, right, are required for us to be able to actually get our specializations. When you become the expert within their field, nobody can tell you that they know more than you. So what's fascinating is that there are legal things that actually are into play. So I'll give you an example. A dentist cannot diagnose what's outside of the mouth. And an MD cannot diagnose what's inside of the mouth. Anytime you actually have a problem relatable to the area of the human body, then guess what? You go to see your specialist. What are the three specialists? Let's call them the MD as a primary care provider, chiropractor as a primary care provider, an osteopath as a primary care provider. But in my world, dentists are primary care providers too. They're not just dentists. Why? Because the very things that they do every single day when they are able to communicate and intervene in their patient's dental health, well, they're having a major impact in the human's life.
Everything else.
It is interconnected. And I'll give you some examples, and this is really going to be fascinating for you. We all know about root canals. Everybody knows that once you do a root canal, the potential for it to be failed will happen. It may take some time. You'll never know because the nerve has been taken out. But, the management of that is lost. So this is where I feel the dental profession can improve a little bit. They should probably take some periapical x-rays rather than just normal x-rays to determine if there's bone loss around those areas. They may take a cone beam CT scan to see the actual 3D image of what it looks like. Those things are very relevant. As a dental component, when they're able to see this, then they'll intervene. But if it's not so obvious, guess what? They tell patients, oh, it's okay, not enough to do anything, especially if you don't feel pain. Well, guess what? These are the same patients who actually go to the MDs going, doctor, my joints ache. I don't feel well. I have a low-grade fever, but I don't know where it's going on. And when they do the blood work, everything comes back normal. So to me, that's an example of latency, delayed reactions, or in this case, a latent infection. A latent infection is not an obvious infection. It's literally below,
Yeah.
the things that we would be considered as a problem. So if we have something like a root canal that is failed, it would be really hard for a patient to say, I have a problem in my mouth if it doesn't hurt. So who are they going to see?
How do you know?
Exactly. So they go and they get, cleanings every 6 months if they're really good about their dental health, or once a year. But even then, most dentists aren't focusing on what? The pathology of these things that are done. They're focusing on the smile, the alignment of the teeth, things that most people want because we're just kind of like vain.
Yeah.
But the reality is that nobody's talking about the effects of what's happening dentally based on the bacterial overgrowth of these anaerobic bacteria that could be driving the immune system crazy by producing tons of endotoxins that go nowhere but directly into our bloodstream.
And we have no idea.
And you have no idea because there's no pain.
Yeah.
I've got another one that's going to blow your mind. You ready for this one?
Go.
Cavitations.
Uh-huh.
A cavitation is an area where a tooth had been removed. And of course, once a tooth had been removed, you're given what? Antibiotics. And you're told to make sure you wash it and clean it and check on it, and then it heals over, right? So how many people have had their wisdom teeth removed?
Oh, with the way we are evolving as humans, right? There is less and less room in our mouth for them. So it is a routine now to remove them when kids are in their teenage years, maybe young adults.
Yeah.
A lot of them.
Yeah. So here's what we see. We see a patient in their teens or any part of their early life that would have their wisdom teeth removed. It's healed over. It's covered by gum tissue now. And guess what? Nobody ever talks about it because the tooth is no longer there. Well, who's to say that over a period of time, the way that our bone structure is made, it's made out of what we call cancellous bone. It's porous. It's kind of like a sponge. And sometimes these anaerobic bacteria, if it's not debrided at the local site, can exist in these areas and it can grow. Once it grows slowly in those areas where it's healed over. Now, it's not anywhere close to the tooth. It's actually where the jawbone is, and it actually fosters or fests into even worse, a situation where bone tissue gets eaten away, but you'll never be symptomatic. We see this so often right now because, in my opinion, that's what's triggering a lot of these potential autoimmune markers.
Really?
Yes, because the longer a person has a cavitation, we tend to wait for a local area to become infective before we do anything about it. But the time that it takes for these things to happen is also a function of time as we age. From every decade that goes on, it's predictive for what bacteria can do to grow. So again, doing screenings like a cone beam CT scan can actually allow a dentist to be able to look at some of these areas to see if there's congruent bone loss. And if there's bone loss, then they may consider doing literally a debridement where they would open up those areas, clean it out as they would, using ozones, using other things that are prophylactic at that area, and then suturing it up and letting it heal. Now, why is that so important? It's because when you're able to get rid of the toxins at the local site, then you're stopping the source of where the potential etiology is. So going back to your communication with the dentist that you did the podcast on, right? Well, more than likely, he's talking about that. He's talking about the very things that I'm mentioning, which is he's doing things holistically to help people with their health and, with their dental health, but lo and behold, they feel better overall. Is it really random?
It's fascinating. It's not random.
It's not random. It's so simple and easy for me to understand. So a lot of patients that I see, I evaluate them as a part of our strategy to see whether they actually do have some of these, medical history and dental history. And then based on that, then we'll guide them and point them in the right direction.
Yeah.
It's a huge, daunting task because you know what? I get this a lot. When I refer patients out to fellow dentists, who are around my area, many of them know who I am, but some people do not know who I am, and patients would go in and say, yes, we need to do a cone beam CT scan. And my chiropractor told me, well, a lot of the pushback would be, well, what does your chiropractor know?
Yeah. I was going to
Right?
say, you probably find a lot of resistance.
I do.
Yeah.
And it's not because I want to do dentistry. I'm not the one treating.
Right.
I just want to be the one educating. Why? Because it will affect the work that I do. Imagine if I went in and I detoxed your body. I gave you everything that you needed to do based on your structural anatomy and did everything right. Everything right. And you're feeling better. And you are feeling better. You're loving it. But yet, as soon as you stop with me a month or 2 or 3, then your symptoms come back. And you're wondering, oh, is this something I have to do for the rest of my life? Well, to me, that's a clue. Because there's nothing in your body that wants to heal better than itself. Your body is
absolutely.
the best healing
Yeah.
component
Yeah.
than itself. So if you are starting to become symptomatic again, then it means that there could be something internal that is triggering these behaviors. And that's where we have to take a look at some of the pernicious things that are happening within the dental component. Now, we can say the same for our gut. We can say the same for a multitude of other things. And our gut microbiome, it's a huge industry with that right now.
Oh,
It's massive.
It's exploded incredibly.
It's exploded within the last 4 or 5 years because the education out there means that, there's so many things that people are dealing with that are symptomatic, which will segue into some things that you and I are talking about in a little bit. But I've been doing stool testing for patients for the last 16 years now. I did this when nobody actually cared for it.
Yeah.
But I thought it was so relevant because understanding the gut microbiome and the health associated with that is so relevant. And in my opinion, we need to, again, help people for where they're at and be able to actually look at it comprehensively, physically, physiologically, psychologically.
All right. This is incredible because it is really hard to find someone who has a holistic vision, right? And you're incorporating so many things and you're looking beyond whatever any other person would do. I want to ask you about something that maybe it is, Estes, how
Fire away.
if you actually have an opinion on this.
Yeah.
Emotional well-being.
Yeah.
How is it related to what you do? And where are we as and you see a lot of people in your practice, right?
Sure. Yeah.
And I bet that a lot of people don't relate physical health and emotional health.
Yeah, I can.
What do you see in your practice?
This is going to segue into the psychological component of what our body has to deal with. I need to, again, because it is a strategy that most people don't understand or something that most people don't connect with, I sort of have to kind of lay it out to them. When we think about our state of mental health, what is the number one criteria that will affect our brain health the most? The physiology of our brain. What is our brain and what does it need the most?
Are we talking in terms of nutrition?
Well, we can talk about nutrition. Let's lay it out. Yeah, the brain is an organ. It needs nutrition, sure. But what is the one thing that our body needs the most? Let me explain. We can go without food for 30 days, approximately, before we become cachexic and emaciated and we need to eat. Otherwise, we die. We can go without water for 3 or 4 days, right? Because without hydration, our body starts to shrivel and we become sick. How much time do you think you have before your brain dies?
I don't know. Are we talking about oxygen?
Yes. How much time?
Not much, probably minutes.
That's right, minutes. From 30 days for food, 3 or 4 days for water, and then just minutes for our brain to actually get into a state where it may be at risk. Think about that for a second. Digest it. Why? Because when I think about life, I think about the order of magnitude when it comes to health and well-being. The amount of oxygen that we're able to take in when we're alive will determine what our brain will do. Because our brain has the capacity to detect the level of oxygen that's in our blood, and if it gets too low, then it will initiate different mechanisms to put us into either a state of fight or flight, or rest and repair. We call that sympathetic or parasympathetic, right? So let's talk about emotional health. When a person who is, let's say, in a state of fight or flight, what are they thinking about?
Preservation.
That's right.
Yeah.
Survival.
Uh-huh.
The last thing that's on their mind is what?
Oh, resting.
Resting or what's for dinner.
Yeah.
They want to know how to be able to live through the stresses that they're able to have.
Yeah.
So when we think about the way that we handle stress, yes, I'm not talking about the details and the things that we have. Everybody has, and created everything around them. But the sensitivities of our brain to oxygen needs to be looked at. And I say that because those are tried and true.
Oh,
For you,
the
for me,
sensitivity of the
yes.
brain.
Yes.
Okay.
The
to
sensitivity
oxygen.
is determined based on the amount of oxygen it's able to get in, either with ease or as a struggle. So I'll use this analogy as well too. Have you ever snorkeled?
Probably.
Yes.
Yeah.
Yeah. Okay. So if you go underwater and you're breathing through a snorkel, after a few deep breaths, you're like, oh, I can breathe.
I can breathe. Yeah.
So I can
for sure.
relax. I can look at the fish. I can swim around. I can really enjoy the marine life.
Yeah. It takes a moment, and then you realize you can.
That's
do
right.
it. Yeah.
But then you realize your brain goes, I can get enough oxygen. I can do this. Now, imagine if I actually made that snorkel in the size and the shape of a straw for you. And you're breathing through that straw. What is going to happen?
Oh, you panic immediately.
Why?
There's no oxygen.
Oh, there's oxygen. It's coming in. But it's
not
just
enough.
less. That's right.
Not enough.
It's not enough. So let's think about the process of that. So you're going underneath the water and you're breathing through a straw, right?
Yeah.
And you're going,
Yeah.
you're able to do it, but look at what your physical capacity is going.
Uh-huh.
It's resisting. It's trying to pull hard into its lungs, and the air into its lungs.
Yeah.
It's trying to get the CO2 out to try to get enough so that you can do what? Breathe.
Breathe.
Snorkel, a few breaths, no problem. You breathe through a straw like that, then your brain goes, we have to be careful here because you know what? There's just not enough for me to be able to relax and enjoy because my body is having to change and shift because my muscles have to react to this behavior.
Right.
And am I going to think about how wonderful the marine life is, or am I going to be thinking about how resistive my body is reacting? That will force me to think about self-preservation, which is my survival. So how will that have an effect on you emotionally?
Oh my God.
It's that simple.
Yeah.
So now let's just liken it to normal daily life. Yeah?
Yeah.
How do you know whether you're oxygenating with your capacity? So you and I are sitting here again. We're talking, we're laughing, we're fine. But at night, where you're subconscious and you're sleeping, that is going to be a very huge factor. So the size and shape of the mouth will determine this. The inflammation that you have in your neck will determine this. The alignment of your cranium as it elects.
So many factors that
That's right.
influence
The
that.
alignment of your neck, your mid-back, your thoracic spine, all of that and how it moves will determine whether you're able to oxygenate with the levels that's needed to get to a state of rest and repair. So as you can see, it's more than just about whether it's just mental or physiological or psychological, or physical. It's all an integration of these things happening all at once to be able to actually allow us to thrive. And who's to say that we're thriving? We're actually just surviving, many of us.
Yeah. Yeah. And I think we're not conscious
Yes.
of it. I think we are used to whatever our situation is. And again, we go through life feeling the way we feel, not realizing that we could do much better.
Yeah.
Much better.
We can. And to say, and being a chiropractor, a physical medicine doctor, someone that actually looks at the human frame, I can tell you that the adaptive behaviors of having a reversal of the spine, or having pain, or having dysfunction is 100% correlative with the airway resistance that we're dealing with. I'll probably am the first person to make this claim in the world.
It would make so much sense though,
Yes.
right?
Yes, it would. So I'll give you one example of what we're seeing. If you actually brace a child and you occlude their teeth because you're removing teeth and you want to straighten them out and you want to be able to put braces on them, well, you do that within the ages of 8, 9, 10 when they're going through their growth spurts.
Yeah.
And then you do it again 12, 13, 14, 15 when they're going through their growth spurts.
Uh-huh.
Who's to say that those restrictive braces aren't affecting the way that the maxilla and the mandible wants to grow, but it can't because it's held tethered? Who's to say that the tongue, as we talk and we chew, wants to grow, which will grow into that anatomy, but it can't push outward to create that expansion and growth? Who's to say that our cranium will grow big, right? And our legs will grow long and our arms will grow big, our shoulders become narrow, and guess what? Our lung capacity shrinks. Yeah. Because we are breathing through a straw.
Fascinating.
That is the travesty that I'm seeing in our society, and that's something that I want to talk more about because it will require dentistry, physical medicine doctors, and medicine to understand what I'm seeing, to be able to fix this major issue, this major epidemic that I see daily. And to me, that's a strategy that we need to own.
You know, this brings me to, I think we're looking at the wrong stuff. When people come to you, for example, or to any professional complaining about something, I think we're looking at the wrong stuff and we start guessing, right? And it doesn't have to be that complicated.
It's not. So when you think about the foundational things that I've mentioned, these are, once you actually grasp it, you'll apply that to yourself first and foremost. You don't need a doctor to tell you. Now, when it comes to something serious and indications, that are much, evaluations, then by all means,
Yeah, of
do
course.
it. Yes,
Of course.
We need all of that. But
Yeah.
I think these strategies are strategies that we should all be armed with so that we know what to do about it so that we can optimize our frame. The reason why I mentioned to you about the dentistry component is because expansion, mouth expansion in orthodontics is the fastest growing segment of that profession. Why is it that all of a sudden now you're getting massive pushes to expand the palate to allow for the mouth to be bigger?
Yeah.
Or they're doing it because they're seeing that airway resistance is affected by it, and kids are not able to breathe, or at least I think that's the correlation, and it's affecting their posture. It's creating physiologic tolls. It's creating deformations in their spine. And when I say that, I'm talking about the curvature of their spine from being an S-shaped curve to a big C-shaped curve. So
Like
when
a
you see
shrimp.
a person slouch like
Like
this,
a shrimp, yeah.
yeah, they're slouching because it's not because they are staring in front of the computer doing this all day long. They're slouching because they are moving forward because they want to move the tongue away from the trachea to be able to take an easier breath.
Wow.
It's crazy.
Yeah, yeah. And it makes so much sense.
How many chiropractors are adjusting patients because they have postural changes, neck pain, back pain? How much rehab do we have to do in physical therapy to build the muscle strength? But yet, if the frame and the foundation is structurally, let's say not sound, you're going to build the muscles to force the spine to get into a position? It's almost impossible.
Yeah.
You got to create joint mobility and stabilization. But if that pattern of survival goes back to a need of air, that means that our brain, when we're not doing these things, will always adapt to airway first. That goes back to what our mind is requiring us to do.
Wow.
It's hard.
Wow.
It's a hard concept, but I am proving. We're working on some studies, and I want to make this known. A great study that I'd mentioned to you is called abdominal phrenic dyssynergenia. And it's a very interesting study that was back in 2022 that was done by NIH. And there's not enough. Hi, Kaito. Come here, baby. Give me 1 second. You want to come up? Okay. I miss you too. It's a study that, really, unfortunately, doesn't have a whole lot of research behind it. But it's a pattern that these researchers and physicians have been aware of. And I believe there's some congruency with that diagnosis with what I do.
Okay.
And what's so exciting is that as I, think about the condition itself, I'm wondering whether, lo and behold, I've been able to find a solution for something that there is no known solution for.
That's incredible. That's really incredible. So these breakthroughs are eventually going to be, I mean, you've been working on this already,
Yes.
right? You see the difference you make in your patients and in their well-being and their health, and they probably get to reverse conditions that they've had for many years.
Yes.
Could you tell me about a specific case, maybe something we briefly talked about earlier,
Yeah.
of a person who came with certain conditions and you kind of like got to deconstruct everything and then put it together
Yeah.
to improve this person's condition?
Sure. So without giving names or anything like that, I'll just give you an example. We had a patient in his early 50s, had chronic back pain,
Yeah.
had postural issues, tries to live a relatively healthy lifestyle. He's a high functioning individual, meaning that, he's achieved success, but his goal in life is to be healthy. His a loved one was struggling with some health issues. And so for him, health is really an important, factor. So when he came in and saw me as a patient, one of the things I did was evaluated him, and I was able to recognize that he had dysfunction, postural dysfunction, adaptive postural dysfunction, and I let him know that he wasn't breathing efficiently. So instead of just adjusting him, I told him that I wanted to do my executive exam. And within our executive exam, it requires, using technology that I have in my office to be able to actually use AI and other metrics to pull and create a baseline for this gentleman. So one of the things that we actually had in our office was to be able to measure the amount of air he's breathing in at rest to determine how much oxygen he's able to get in and out of his lungs at, let's say, a 15-minute interval.
Okay.
And so that's important to me because guess what? I want to see if I can actually change that. So going back to that analogy where I said there's a V4 versus a V6 or a V8, well, the gentleman structurally was about a V8, but he was functioning as a V4. He didn't know that he had airway obstructive issues.
He had a small carburetor, to say it in a way.
Whatever else he's got. Yeah, he was literally adapting. But long story short, my goal wasn't to have them, go in and try to do a VO2 max. I didn't want him to push his capacity. I want him just to breathe normal.
And can you tell me why not?
Because when you're actually exercising, what you're doing is you're using an excited state. You're getting to that aerobic state to really work your heart and your lungs. So that increase, exercise will allow you to really take in enough oxygen more. So that's a function of good health. So we all know that if we exercise, we do it for an hour, it's been proven that that will increase your longevity and wellness. Right? So everybody knows that.
Yeah.
But guess what? I didn't want people to just tell them to go exercise. That's what everybody does.
Yeah.
The three things in life, it doesn't matter how good you are as a doctor. If you tell your patients, eat well, sleep well, and exercise, that's the key to longevity. Well, in essence, it's true. It is 100% true. There's no lie about it. But what they don't tell you is that what's your capacity?
Yeah.
And for me, knowing your capacity, understanding how much charge you have, matters. Because a person can go and exercise like a demon, but if they don't have the capacity to detox, now they're creating a problem. A person can eat all the healthy foods, but if they can't digest and if they can't break it down and they can't eliminate and detox, then they're in trouble.
Yeah.
A person can go and do hamana strategies and meditate all day long, but you can't meditate when you've got to make a decision for your workers and your employees.
Yeah.
No. These type of things are things that happen daily for every single one of us. We need to understand how to be able to manage that and make it better for us. And the best way to do it is to use my 3P strategy. Now, going back to that gentleman, I had him breathe through normally because I wanted to measure what his capacity is at rest.
At rest.
And then what I was going to do
Yeah.
was I was actually going to change and do some structural changes with him, non-surgical. myofascial releases, the techniques I've created to mobilize the fascia so that it will be more rhythmic and organized with his diaphragm and the way that his rectus abdominis muscle or his abs can move. And we were able to do that, put him through a program called our Core to Floor program.
Okay.
And within 1 month, we're able to measure his capacity. Well, guess what? He increased it by 50 mLs per minute.
That's huge.
That's huge. Now, without getting to the details of
And-
what that means, which
but-
we can,
Before you continue,
okay?
didn't start going to the gym or changing diet or anything of that sort.
No, we don't want him to, because when patients are going through our program, what we do is we try to keep the baselines very minimal. We're not having them do anything to change their lifestyle, because I know that when people want to get healthy, they tend to do too much. And in order for me to actually see whether my programs are making a big difference, I'm focusing on the physical capacity first. So I tell patients, just carry on with the way that you've been doing it before. So if you exercise moderately or lightly, then go ahead and continue with that. If you don't exercise, then don't do that. Or if you eat a certain way, go ahead and do that. Whatever you do, don't abuse. I'm not saying that you don't do that for your betterment in the future, just during the program, because we want to keep it as organized as possible and simple as possible.
And you really want to see the effect of a program on the person without changing any other factors around it.
That's right. And look, we're working towards making all of this process better, but the amazing thing is that we're able to have such an effect and a change in his physical capacity at rest that he increased it by 50 mLs per minute. So what that means is that you multiply that 50 mLs per minute times the 24 hours that he's breathing.
Oh my God.
The total oxygen intake is more than if he were to work out moderately, aerobically for 1 hour. And that son of a gun is not doing anything except for just breathing.
And by modifying this structure, right? It is something that this person is going to carry out through life, right?
Yes, because during that program, you're retraining the muscles.
That's the new floor.
Yes, you're creating a new baseline structurally, and you're increasing their capacity. Again, going back from a V4 to a V6 to a V8, we're actually taking that individual, creating that new capacity. Now, if they were to incorporate strategies for health, eating healthy, exercise, then they're just going to have a brand new foundation to function with. To me, that's so exciting, because that's not something anybody is doing. We're just reacting. So,
are you writing anything about this? I'm sure you're documenting this, right?
Yes,
but is it going to be on a paper at some point?
Yes, we're working towards that. It's hard. I'm a solo practitioner with with a staff, just trying to do the best that I can. I'm heavy into my patients, so that's taken a lot of time. But yes, the research is there. We're pulling it together. I will be working on some data to be able to get it out there.
That's incredible.
And I want to. And in fact, I feel like I'm on a mission to do it, because seeing what I'm seeing, it breaks my heart to know that that patients who are coming into my office, they are just literally struggling with with so much, but yet they've seen so many doctors and they just don't know what to do. And so when they're able to understand what we're talking about and do the very things that we're able to do, their life changes. And they're happy. They're living their Ikigai.
The Ikigai, right? Why don't you tell me or tell our audience a little bit about the name of your practice?
Wow.
Because I think this is actually very cool.
Okay. My practice is called Ikigai Wellness. And Ikigai is a Japanese word that means living life with a sense of purpose in the pursuit of happiness. There are 4 things that help to essentially make that integration real: mission, passion, vocation, and purpose. When you're able to do all of these things and maximize them, then you have Ikigai. I pivoted to name my practice that because it's not about let's say, a place of pain relief. It's not a place where you're going in and you're treating a condition. It's literally a wellness center to be able to allow people to understand that when they go in, they will learn something about their body. They will understand their physiology and they will understand where their mindset's at to be able to actually have a tool to allow them to live their life using the Ikigai strategy. Everybody deserves Ikigai, by the way. You know, it's not something that you can buy. It's not something that you can kind of just, want. It's something that you have to work towards.
Yeah.
But the beauty is this, when you're able to achieve these types of things in a way that is simplified, I like simple, by the way. Sounds complicated, but it's really simple. Then it allows people to have a strategy that works for them to live life happily. You know, I'll share a couple of stories, which I think it's really important
Yeah.
for people
Yes.
to know. We had a gentleman who came into our office who was in acute lower back pain. He couldn't move very well, and his spine was so linear and straight, top to bottom. And I was thinking to myself, my goodness, I can barely move or adjust this gentleman. Adjusting means to manipulate his spine. So as I was evaluating him, I knew that he actually had some major dysfunctions. He was a former college swimmer. He had all these types of things that he used to do, but now he's a hot mess. Can't walk without feeling pain. He can't exercise without not being able to recover.
Wow.
I mean, he was just struggling. So long story short, I identified the issue with him is that he's had struggles with breathing. And
With breathing. And
with
he was a
breathing.
swimmer.
Yes, and he was a swimmer. And what's interesting is this, college swimmer, no less. Powerful, athletic guy. Well, guess what? I found out he had an anterior tongue tie. So an anterior tongue tie, for those who don't know, is something that actually attaches from the tip of the tongue that doesn't allow the tongue to move forward and backwards and side to side. So it actually becomes occlusive.
Yeah.
So it's easier for him to swim face down because he can breathe easier and turn than for him to actually sit up straight. Because as soon as he sits up straight, guess what? His throat gets occluded and he's going to have to lean forward. So his posture was predictively forcing him to straighten out to allow him to breathe. So treated him, deconstructed him, and retrained his muscles in a way to allow him to optimize his breathing. What's so fascinating is this. After 1 month, he felt better. His back pain was going away, but he didn't really understand his breathing. And he admitted to me, he goes, Dr. Lee, I just want to let you know, several years ago, I planned a trip for my family, my wife and my 2 kids, to climb Mount Kilimanjaro. And I can tell you that I don't know whether I can do it because I can't breathe very, very well. My back hurts so much. And I looked at him and said, Chris, just do what I tell you.
Yeah.
Continue. We're going to continue to work on you. We're going to continue to build you up.
Yeah.
And don't worry. In 3 months' time, when you go, you go. So guess what? After another month and a half of working on him, and he was taking every single thing that I taught him, and he was running with it. When I had him breathe a certain way to contract the right muscles, he was doing it.
Changed him.
And he was doing it because he felt a change. He felt a difference. His back was improving. His posture was better. He was moving in ways that he hadn't moved before. A month and a half later, he shows up in my office, and he hands me this, and I want to show you.
Oh, wow. So he actually went and did it.
He did it.
This is incredible.
Yeah.
Incredible.
So that's a picture with him holding a sign that says, "Thank you, Dr. Lay." And I didn't ask him.
That's amazing.
I didn't ask him. And, and for those who want to see, this is him with his sons enjoying sunrise on top of Mount Kilimanjaro. And the fact that he wrote this, "Thank you, Dr. Lay," is so powerful for me because what I did for this gentleman wasn't about back pain treatments or doing things as a doctor. What I did was I actually gave him the ability to know that he can accomplish the very things that he didn't think he could. So this gentleman is
How
living...
powerful is that,
It's
right?
very powerful. This gentleman is living his Ikigai.
Yeah.
This gentleman is enjoying time with his family, himself. He's
That's
pushing the
so
limits.
awesome.
He's creating a brand new foundation
So
for
awesome.
him.
Yeah.
it's that's what we're seeing. You know, in fact, I'm sitting here with you and I want to get this message out. I
Yeah.
want to be able to
Yeah, yeah,
teach.
yeah.
I want to be able to really force people to look at things differently so they can pull in the research necessary to prove me right or wrong. And I'm okay with that. But I think we need to look into this. And frankly speaking, I'm living my Ikigai.
That's amazing.
Yeah. Every day when I go to work, I get more satisfaction in seeing my patients get better, knowing that these are the strategies that would do. It gives me no greater joy than to see them achieve their greatest health.
Satisfaction. Yeah, that's
Yeah.
unbelievable.
Yeah.
Well, this is probably the first of many conversations we're gonna have because there is so much more that you can teach us because you have so much knowledge and you know 1 hour or so is not enough to get the whole picture across, right?
Of course.
But this is a great start, and this is amazing. Thank you so much for making the time to meet with me and to get to interview you because so many people can benefit from this.
Thank you, Will. I really appreciate the opportunity. This is, as I mentioned to you, I've been asked to go into 6 different podcasts from different folks, and I chose you first.
It's a privilege.
Well, I did because 1, you're a good friend. 2, it's amazing to me because when you said you wanted to pursue something that you're really happy with, and this is what your purpose is.
Yeah,
I was thinking
we had
to myself,
that conversation. It makes
I was
sense,
thinking
right?
to myself, my goodness, who am I to not be a part of this? And you're asking me of all the people. So I feel a lot of gratitude. And sometimes when you feel like you're able to have a platform that you can build on, I think we're just getting started. I think there's something here that's important, and I'm mission based to make this relevant. So again, I hope people understand the reasons why I'm doing this. It's not because I want to prove anyone wrong. I want to be able to add and connect the dots for folks.
Yeah. So I normally finish the show with a simple question.
Sure.
If you were to give 3 pieces of advice to anybody in terms of how to make your life easier or better or have a better lifestyle or whatever you consider that is relevant, what would you say?
Yeah, that's a hard one, knowing what I know, right? And the details that go along.
Yeah.
But if I were to really just be, purposeful with that, I want to say that before you look outwardly to, search for health, you need to take a nice deep breath and recognize whether it's a struggle or not. Quiet, deep breath. If it's a struggle for you, then you know that's where you start to be able to actually understand how to improve. Whether you need to do meditation, whether you need to do exercises, what have you, if you feel just taking a nice quiet breath is a struggle, then more than likely you've got a weakness or a dysfunction. That's one. The other 2 is this. It's quite simple. Family is everything.
I love that one.
Family is everything.
Yeah,
so when we're
that's
all
amazing.
born, into a family, and we all came from somewhere, the people around you and the people that you interact with will determine your own happiness. So keep them close. Keep them close. Live in the present. Recognize that whatever's happened in the past, you cannot change. Whatever in the future, you can only predict and you can work towards, right? But the only way that you can actually control where your destiny can come is to actually be present. And the energy that it takes to be present, that's where your energy should be spent. So I'll give you an example. If you find yourself depressed, well, the more you think about that depression, the more you're actually living in the past. When you're actually able to understand some of the things that we're able to do, then knowing that you can take a nice deep breath, knowing that you can figure out a way to pivot your mind, pivot your decision making, so that you can allow yourself to achieve Ikigai, that, in my opinion, is really powerful. So it's not one thing, it's probably a multitude of things, but that is the foundation of who I am and what I do.
It's fascinating you mentioned the living in the past and not being present. I recently interviewed a doctor in Bogota who dedicated his practice to mental and emotional health and helping his patients through that. And he said something very similar.
Mm-hmm.
If you're looking back, you're not gonna feel good. If you're looking into the future too much and maybe envisioning problems that don't exist yet,
Yes.
it's not good for you. And we're forgetting to be present and to live a moment and to enjoy the people who are around us.
Yeah, and it's simple. I mean, it's all around us. We know how to live life, every single one of us.
Yeah.
Everybody here and everybody around. Our presence is a gift.
Uh-huh.
You know, keep in mind that when you've been given the gift of life, we're able to have an opportunity to take one breath when we're born,
Uh-huh.
and we'll all take one last breath when we move on.
Yeah.
Whether it's Kaito with me, whether it's you and I, well, my journey has led us here, and I want to continue to do the best that I can to contribute, because guess what? You and I will move on just like everybody else.
Mm-hmm.
But what we do with our lives and what we leave behind matters. And so to me, that's my mission.
Amazing.
Thank you.
Well, again, thank you so much for opening the doors of your practice and for us and for your time, because I know that you're a busy, busy person.
Thank you.
And again, I really hope that this interview has been enjoyable, great for everybody. Hopefully, we're going to have Dr. Lei again in a near future. And this was A Tu Salud, which in English means to your health.
Oh, wow.
All right.
Love it. Thank you so much.
Gracias por compartir un rato con nosotros y escuchar la voz de nuestros expertos invitados. Si te gustó el contenido, síguenos en tu plataforma favorita y en redes sociales. Un abrazo y nos vemos pronto. Esto fue A Tu Salud.